Hello, and welcome to the snack program offered by the Rotary Club. Oh, I think everyone just joined. Welcome to the snack program offered by the Rotary Club each Thursday at noon. The snack is different than our Tuesday program as there's less to it. It'll last about 30 minutes, and of course, you can still count on a high-quality program and content. Typically, we will feature a member of Rotary or a Rotary-connected organization with ideas pertinent to how we're living today. Today, you're going to hear from Anthony McHenry, who's the CEO of the Milwaukee Academy of Science. Next week, please tune in on Thursday to welcome back Caitlin Cullen, owner of the Tandem Restaurant, to discuss her latest neighborhood initiative. Some more housekeeping. Please feel free to submit your questions via the chat button at the bottom of the screen. We'll keep an eye out for them and share them with the speaker once the planned remarks are complete. We will also open up the discussion for you to ask your own questions of Anthony at the end of the program, and I highly encourage that you do that. Now it is my pleasure to introduce Anthony McHenry, CEO of the Milwaukee Academy of Science. I choose to serve on Anthony's board for fun because I believe Anthony and his team have found a powerful solution to tangible educational issues in our city. I've had an opportunity to work with a lot of amazing leaders, including many of you in this city, and I am thrilled to tell you that I hold Anthony in very high esteem. He is one of the amazing leaders in our community, and he is one of the most thoughtful and insightful individuals that I know that really has insight into what is happening in our city and for our challenged youth. And with that, Anthony, it is my pleasure to have you take the floor.
Well, first, let me just thank Ryan for not only oops.
Anthony, my apologies. I accidentally paused your video. There we go.
Okay. Okay. Well, again, first, thank Ryan for the introduction, the kind words, and most importantly, for serving on the board of Milwaukee Academy of Science. What he failed to say is that I reached out to him right away when I got this position and maybe begged, maybe bullied to try to get him onto the board, and he's been a tremendous asset to our school. I want to make sure that I get through my prepared presentation as soon as possible, as quickly as possible, because I'm really interested in the comments and whatever questions that you, my fellow Rotarians, have. And in order to really talk about the challenges that schools are facing related to COVID-19, it's critically important that I give you the context of who we are as a school, because each school has very different challenges in responding to COVID-19. As an example, we're located on 21st and State Street. Just 2 blocks away is Marquette University High School, but we're serving 2 very different populations, and our challenges are very different. Our staff is very different. And so I'll speak specifically about our challenges, and but also be able to provide some commentary about the broader Milwaukee community and schools and the challenges that they are facing. All right, I'm trying to move my slide. All right, so who is MAS? We were started in 2000 by a gentleman by the name of T. Michael Bolger, who at the time was the president of the Medical College of Wisconsin. And you can imagine how busy Mr. Bolger was, but he thought it important enough to start a school essentially because he saw that of the 1,200 or some odd students that were coming into the medical college each year, less than 1% of those were kids from Milwaukee, and even less than that were minorities coming from Milwaukee. So he wanted to create a school where children, particularly minority children, would love the sciences. We're a public charter school. What that means for MAS is that if a parent fills out an application and we have a seat, they are in. If there's a waiting list at that grade, if a seat becomes available, we have a public lottery and select the child to fill that seat. There's no selectivity at all about who gets to attend school here. We're serving over 1,200 students this year. 99% of our students are African American. 94% of our students qualify for free or reduced lunch. We have a homeless rate between 6 and 9%. To give you perspective, that's about, when we've surveyed our families, it's between 60 and about 114 have been the ranges of how many kids on a particular day are classified as homeless. At least 10% of our students receive special education services, and we provide transportation for 90% of our students. Our kids are coming from 21 different zip codes to attend Milwaukee Academy of Science. And I want to point you to the map that we have in the bottom right-hand corner. This is a map of schools that are serving a similar population, at least 90% economically disadvantaged, at least 80% minority, and at least 10% special education. These are the schools that are serving kids through high school with those demographics. Unfortunately, those red dots that you see are all schools that are performing at the lowest level according to DPI. They're at the fails to meet expectations level. There's one dot that is kind of a beige color that is that's at meets few expectations. It's one level up, and there's no schools at the meet expectations. And this beautiful blue dot that you see is Milwaukee Academy of Science. So in fact, if you look at the schools serving our population, we're the lone school that to date is doing a good job of providing a good, strong, rigorous education for those students. So again, we're at the exceeding expectations level, and we've been there for now 3 consecutive years. So this is MAS on March 12th. I'd also like to share a couple of other things that was happening on March 12th. Our girls basketball team had just won the regional championships and participating in the sectional championships. Our boys basketball team was ranked #1 in the state and headed to the state tournament for the first time in our school's history. 5 seniors had already accepted full scholarships. 5 of our 40 seniors had already accepted full scholarships to prestigious universities like UW Milwaukee, 2 to UW-Madison, 1 to Bradley University, and then another to Duke University. We'd already received 200 applications for the upcoming school year. So we were on pace to, for the 2nd consecutive year, have a waiting list at 10 grades for the school. And then March 16th happened, and we closed indefinitely. And so we are fortunate, and our scholars are fortunate, that we was able to plan and prepare prior to the 16th when we closed. We started a full virtual program that very next day. So there was no gaps in services. We know that many of the schools here in Milwaukee were struggled to restart. Some did not start at all, but we was able to start the next day. We was able to distribute about 300 Chromebooks and some hotspots to make sure that kids, particularly our seniors, could attain credits towards their graduation. And we also created a meal program, both a curbside meal program and a delivery program, to make sure that our scholars, particularly those who have the greatest need, was able to continue to have 2 nutritious meals per day. When we initially closed, I really thought that we were looking at about a month for our closure. But by the time June rolled around, it was pretty clear that we were headed in a very different direction. And so we started asking our families questions like this. We asked, would they feel comfortable returning to school in the fall? And as you can see to the circle graph to your left, that 38% of our families said, in fact, they are not comfortable sending their kids back to school in the fall. We asked about technology devices for our students. Over 40% of our students did not have devices that they needed to continue for having an education in the fall. But then we asked really important questions like, what was happening with the families and their employment? And you'll see below that 16% of our families indicated that they had a complete loss of employment, and 30% of our families indicated that they had a partial loss. And so to keep things in perspective, think about what that really means for our families. 94% of our families are at the poverty line, which is about $22,000 for a household of 3. And then on top of that, about 45% of our families had some employment loss, and they already were really financially challenged. So it paints a really gloomy financial picture for our families. We also asked if they had family members who had been diagnosed, and 12% of our families had close family members who were diagnosed with COVID-19. This is by June. And then unbelievably, or unfortunately, 9% of our families had indicated that they had a COVID-related death in their families. And again, this is in June. And the other thing that we had to keep in perspective was this was an online survey. And so many of our families don't have devices or don't have Wi-Fi at home. So many of our most challenged families were not even able to participate in this survey. And yet, this paints a really, kind of gloomy picture for our young people. So, I do want to say that part of the challenge that we faced as a school was having the dilemma of trying to prepare for multiple school years. So, despite the fact that we gave out 250 Chromebooks, 44% of our students still didn't have a device at home. We later learned that 30% of our students did not have internet access. And that posed a significant problem for us, in particular because on July 17th, the City of Milwaukee's Health Department informed all schools that they needed to start with a virtual program and would not be able to move to in-person school until we reach phase 5. So we then stopped trying to prepare for 3 different school years, a all virtual, a all in-person, and then a hybrid model, and really focused on a virtual program. And on August 31st, we started our virtual program. There are some really unique challenges that comes with the virtual school. First and foremost, our 70 some odd teachers had never taught in a virtual school before. In fact, they signed up to build really strong relationships that are easy to develop when you're seeing kids every single day. And so that was a huge challenge for us, is trying to get our staff prepared for virtual programming. They also had to learn all of these platforms that you see to the left. These are all the platforms that we're using to provide the education this year. Most of these our staff was unfamiliar with going into this school year. And so we had to educate them on all of these different platforms. And then one of the things that really caught me off guard was the workload for teachers seemed to be even greater with a virtual school than it is in a regular traditional school. Having to learn the new devices, the platforms, get yourself to a place where you can navigate the different platforms during the course of the day, then provide that level of education to your students and families, all just provides a pretty significant workload above and beyond what we traditionally do as educators. The other big challenge is when we know that most of our families are living in poverty, we know that many of our families are homeless each day. We also know that our families are dealing with significant trauma in their families and in their lives. And so we really needed to double down on what really is the strength of our school, which is amazing relationships that helps us to create this successful model, and really prioritizing the students' social emotional health and wellness. And so it became our teachers and staff's responsibility to check in with every single kid every single day that they're not online, so that we can connect with them, make sure that they're well, and provide whatever supports that we can. There are some opportunities that comes with the virtual learning, and as a charter school, a public charter school, we have the ability to be flexible and create a program that we felt was going to work for our school. And so what you see in this calendar is maybe the most rigorous and intensive instructional programming that you'll see in our city, particularly for those serving our school. And so I'm really proud of the work that we're doing. Even as young as age 4 years old, our kids are expected to do 3 hours and 15 minutes worth of work, and it increases as the kids get older. Another opportunity that we had is, this is maybe forced, but all of us are coming out of this with some new skills. Our students have to figure out how to navigate systems that are very different than they've had to navigate. And our teachers have new skills and tools that they can use at their disposal to help support our kids. So there's a lot of, there are a lot of opportunities that kind of come out of this as well. You're likely aware that the health department is now allowing schools to submit a school reopening plan. And once that's completed and approved, that schools can have in-person school with a 50% capacity, with social distancing mandates and following the mask mandate. So we're currently in preparation for submitting our school reopening plan. However, we do have to take many things into account. It's not as simple as, once our plan is approved, that we can and should open our school. And some of the zip codes that we're serving, their positive rates are in the 30%. One in particular has a positive rate of 34%, another has 30%, and another has 28%. As long as those zip codes are having rates that high, we can't safely open our school. And so we'll have to monitor what's happening in our service area and the places where our kids are coming from, in addition to getting the school reopening plan. So as we prepare, there are obviously significant challenges. One, we have to conduct a full virtual program for over 1,200 kids and simultaneously plan for a hybrid school, where about 50% of our kids are in person and about 50% of our kids are learning online. That creates a challenge in and of itself. There are staff and student fears that we have to respect. Many of our staff are fearful of coming back in the building, particularly because they know that the positive rates are so high in our city, and particularly in the inner city where many of our kids are coming from. This hybrid model is extremely expensive. Our CFO today reported that we've already spent over $300,000 in devices and hotspots and things of that nature, and the costs are going to continue to increase, including our transportation costs. I mentioned earlier that 90% of our scholars ride our school bus. 18 buses, over $1 million was the cost last year. And that's going to increase when you can only put 50% of the students on a school bus. And so we're looking at increased costs in transportation as well. And then I don't know if any of you on this call has figured out a way to keep 4-year-olds 6 feet apart from each other, or 18-year-olds 6 feet apart from each other. But that's the challenge that that we're going to have to face when and if we return back to school. But again, there are some opportunities available to us. Our staff is just so much more knowledgeable now in terms of how to use virtual and online programs, and we'll continue to do that even when we return to normal school. We'll continue to use some of these online platforms as well. We also want to continue to put student wellness first. We know that trauma has long-term impacts, and so we want to continue to monitor, check in on our kids, and provide all the resources that we can to ensure that our kids and our families are healthy. And then again, as a charter school, we have the flexibility to accelerate learning. So we're looking at Saturday school for children who are significantly behind or who had a tremendous loss of learning over the past few months. We're also looking at extending our school year and providing a much longer and comprehensive summer school program going into this summer. So those are opportunities that we want to take advantage of. So there are some takeaways that I want to make sure that you have. One, COVID-19 is hard on children and families living in poverty. Again, so many of our families lost employment, further making their financial condition and resources limited. Also, virtual programming is difficult and it's very expensive. Our hybrid program that we're going to start is going to be even more difficult. We gotta educate two groups of students, in person and online, and it's going to be even more expensive. You know, I talked about the transportation costs and the device costs. That's going to be even more expensive, and for a school like MAS, a charter school, we receive $2,000 less in funding. So these challenges are already on top of the challenges we have as a school, providing our staff and students with the resources they need. But most importantly, the takeaway that I want you to have is that our kids coming from the most impoverished communities, dealing with homelessness, dealing with all of the challenges that they can and have learned, and MAS is a shining example of what we can do when we truly put children first and provide the resources to our staff and students to help them become successful. So with that, I would be happy to entertain any questions or comments that you may have.
Okay, Anthony, I'm kind of tag teaming. Oops. I'm kind of tag teaming with Ryan because he's off to celebrate his 10th wedding anniversary today. Dr. Gleason has put some really great questions in the chat, so I'm going to add them here. And I should just note that I am a huge, huge fan of MAS. As Anthony knows, my husband serves on the board of directors with Ryan, and we have a great love for the organization and all that it's doing. A couple questions from Dr. Bob. If any student who completes an application is accepted, how do you get such good scores? And what is the college acceptance rate?
Yeah, that's a great question. So I'll start with the latter. So for 6 straight years, we've graduated 100% of our seniors, and for 5 consecutive years, 100% of our seniors have been accepted into post-secondary education. The answer to your first question is a lengthy one, but I'll try to summarize it as quickly as I can. One is, as a K-4 through 12th grade school, we have an amazing ability to develop strong relationships with our children and our families. And that relationship is really at the centerpiece of our ability to create hope for kids. They know that they're living in a city that is difficult, particularly for low income and African-American children. They know that many of the schools are really struggling to provide a quality education. And so we need to use those strong relationships to create hope for those children and those families. And it's part of our strategic plan to make sure that we do that, and we have strategies to create a student-friendly and a parent-friendly school. The other piece of it is I am anti-school as normal, right? I tell our staff all the time, I don't want a quiet building. I want a building that is that is maybe positively noisy, that kids are excited about what's happening in the class, that there are smiles on the faces of kids as they're walking through the hallway. And we've been able to do that. We've been able to create a very unique environment here. So much so that when I asked our students at across the board, well, actually from 3rd grade to 12th grade, a survey of do they feel like their teachers genuinely care about them? 100% yes. We asked our students, do they feel like the teachers will go above and beyond to help them be successful? 97% of the kids said yes. We got to figure out who those 3% of kids are and check in on them. But the reality of it is we're creating a culture here that that gives our kids the ability to feel safe, secure, know that they're loved. And then for our staff, it is critically important. And one of the, maybe the most important things that I was able to accomplish early on was to raise the bar, right? I grew up in poverty. I grew up without a dad in my household. I grew up in a community that was full of violence. And I'm an okay human being. And so our children growing up in really difficult situations, they have the capacity to learn. And we're going to put a really high bar, high expectations. Our motto is champions of high expectations. And then it's our job, this is a really important part, to push and pull our kids to those expectations. I do not believe that the onus is on the kids to learn. The onus is on us, the adults, to help the kids to be successful and to learn. And so it's our responsibility to make sure that those kids are learning, and that plays out in how we go about our school day. Sorry for such a long answer.
Not at all. Another one actually from Dr. Bob was, can you please tell about MAS pre-COVID? How much emphasis is on STEM? And along those lines, have you any graduates that have gone on to the medical school as T. Michael Bolger had wanted?
Yeah, Dr. Gleason is speaking my language. So we're in fact, we're a STEM-focused school. And it's across our entire school. We have STEM classes for our 4-year-olds, and we have STEM classes, significant ones, and many options available to our oldest kids as well. So you'll see it all throughout our school. And one of the ways that I really like to, kind of judge how we're doing as a STEM-focused school is just walking through the hallways and asking kids what they want to become. Teresa has been to our school, and maybe some of the others have, and I do it all the time. And it's amazing. I would say 95% of our kids quickly answer with a STEM-focused school. So much so that we created a health science prep program because we had so many juniors and seniors that was looking to be in the medical field. And Dr. Gleason, you'll be happy to hear this. None of them say I want to be a doctor. They say I want to be a cardiologist. I want to be an OBGYN. They speak specifically about the type of doctor they want to become because they've had so many different experiences here at the school to be able to have that level of selectivity. And to your greatest question, we have a student that is a graduate student at the University of Madison who will be our first student at the Medical College of Wisconsin. I'm super excited and can't wait till she walks on their campus.
I had a question, Anthony. Do you want to share a little bit about the need for transportation? Why do you spend so much money on transportation?
Yeah. Well, I'll start by saying transportation is expensive and it's also my biggest headache. But it's core to who we are as a school and our ability to address the equity issue. One of the challenges that I think that schools face and oftentimes cripple schools is just the mobility of the families. It's hard to create a really strong school culture. It's really hard to invest in kids year after year when they're moving multiple times in the course of the school year. Our most recent survey to try to get to our families' mobility said that 40% of our students have moved at least once in the last 3 years, and 25% of our students, a fourth of our students, had moved at least 4 times in the last 3 years. They're moving for economic reasons, right? They're being put out of their house. They're avoiding evictions, things of that nature. As long as they land in the city of Milwaukee, we're going to send a bus to their house and pick them up. And so it is critical to who we are as a school, our desire to want to be able to serve all students, and quite honestly, it's the work that we need to do from an equity standpoint to ensure that our kids can continue to come to MAS.
You mentioned earlier about the 15,000 meals that you created and provided when COVID hit. Are the kids getting meals now that they're being taught virtually?
Yes. So we still have the curbside meal program. I think yesterday's number, we had 100 and some odd kids that was able to get to the school to receive a meal. We also have a delivery program, but it's scaled back from what we did during the March and April, because at this point we can't meet the needs of trying to serve our entire school through a delivery program. So we reached out to families who indicated through the surveys that they have food insecurity issues. We reached out to families who said they have childcare issues, and we reached out to families who have been identified as homeless or in the past were homeless, and are providing meals to any of those families who can't get to the school. And then anytime, again, we're doing wellness checks on our students, and anytime that during the wellness checks that there's a hint that there may be some issues with meals, we direct them to our parent engagement coordinator, who will then connect them to a delivery meal program.
Okay. Thank you. Darren Miller, our current president, had the great opportunity to be one of the founding board members of the Milwaukee Excellence Charter School.
Mm-hmm.
And he said one of our greatest challenges is busing. One route could literally break the budget. How can a school plan when this is such a huge cost?
Yeah. Yeah, it's a great question. And I was not joking when I said busing is my biggest headache. And the reality of it is that the transportation, the busing industry is just having a really difficult time pre-COVID, and even worse with COVID. And the big challenge is, how do we keep bus drivers and get bus drivers? So so that's a challenge, but the reality of it is we're in a world now where we have to take all these precautions, and we have to be really strategic about how we go about transportation, even more than we've ever done in the past. So right now, one of the things that we're looking at that Milwaukee Excellence may want to consider too is a bus opt-out program where we incentivize parents to try to find other means to get their kids to school. Because quite honestly, it costs, several $100s for every kid that gets on a bus. Would the school be better off giving a portion of that to the families in exchange for the families finding a way to get their kids to the school? Now, our bus out program mandates that the kid has to be in attendance 94% of the time. Our school average is 93%. And so we want to make sure that those kids are here as often as possible. But we're having to find really creative ways to get our kids to school, because the cost of transportation is really, really high. We're going to I think we're budgeted for $1.3 million this year. And then in COVID, where you can only put half the kids on the bus, that's going to be challenged. So, we're trying to find really creative ways to reduce the number of kids that need the bus to get to school. But as I said earlier, we're serving kids from 21 different zip codes, so including all the way out to Bradley Road.
We're at 12:34, I think it is right now. So I'm going to see if there's anybody else that wants to just chime in with their own questions. I really want to thank you so much, Anthony, for doing this today and for being such an inspiration to the kids at MAS. It's wonderful.
Feel free to unmute yourself if you have any questions.
Anthony, super program you're running. It's so impressive.
Thanks.
That you take anybody who wants to apply and you turn them into this great scholar who's interested in higher education and specific careers. Awesome work.
Yeah, thank you. Thank you. I'll share a quick story. It's really a 10-minute story. I'll try to make it 15 to 20 seconds. We had a young person that came here at K4 with as many challenges as you can imagine for an inner city kid. Her two older siblings both are serving pretty long prison sentences and both made the evening news. So you can kind of guess kind of the level of damage that they were committed in the community. And this young lady was very, very difficult for us. We almost never expel kids. In fact, the year before I got here, we expelled 48 kids. Last year, we expelled 1. But I had to sit back a couple times and say, I don't know if we can continue to have this person at our school. So where is she now? She went to the University of Virginia, you know, one of the elite programs in academic institutions in the country. And one of the things that I had to share with our staff early on in my tenure here, I'm in my 5th year here at MAS, but I must have said this many, many times my first year. We're not a college prep school. Our kids do not have to be ready for college until they graduate high school. So every day before then, it's an opportunity for us to help them become the person they need to be when they graduate. And again, it goes back to our commitment to relationships, and it also goes back to the length of time that we get to serve our kids. Because in 9th grade, it was probably more likely that this kid was not going to graduate than to go to anybody's college. But the light turned on. And sometimes the light turns on early for some people. And there's some people that's like Anthony McHenry, well, it takes a little while for the light to come on. And we want to be able to serve those kids as well.
Anthony, I just want to chime in from afar and say that it really is that I believe you can take just about any student at any level, and when you indoctrinate them into the culture, take them through graduation. I know you talked about this, but the fact that your high school has 100% graduation rate multiple years in a row is a testament to more than the education, it's the culture.
Yeah, thanks. Yeah, it's not easy. I can tell you some of the things that we've done to help kids get across the finish line, including our CFO, who there's nothing in her job description that says anything about working with kids, essentially just adopting a kid and tutoring him and paying for tutoring and picking him up in the morning, getting them to school. It took all of that to get him across the finish line. And there's so many stories of that. In fact, I got an email just yesterday for an Adopt a Senior program. And normally we do this in March when we figure out who are the seniors that are in jeopardy of not graduation. But with this virtual program where the challenges are so much more significant, we're starting the adoption now. So I'm adopting 2 kids, and I got to be in contact with them 2 or 3 days a week, and their parents, and checking in with their teachers. But it's what we need to do to help our kids overcome the challenges that they have. And quite honestly, many of them are living in households and communities where they don't value education as much as we do. And so I just believe that even if that's the case, we're going to find a way to provide them with a good education and ensure that they go to post-secondary education.
All right, then. Thank you again, Anthony, so very much. We'll let you get back to work and working with those great kids, and we'll see you at Rotary.
Can I give you one other plug?
Sure.
So I am a school leader of a strong school, and like any strong school, we give out homework assignments. So everyone's homework assignment is, if you know anyone that's interested in learning more about a school like MAS or wants to be involved in MAS in any way, please do send them our way. There are so many ways to get engaged here. And also, we are expanding our school. And so if you have connections to foundations or others who might be able to support us in our effort to expand our school to serve more kids, please do consider us, because right now our school has grown so quickly that we literally do not have enough room in our middle school and high school to serve all of our kids in elementary. And so it's one thing for us to say, you know, sorry, we have a waiting list, we don't have space for you. It's a whole nother thing to tell a kid who's been here for 6 or 7 years that we don't have space for you next year. And so That's not a conversation I want to have with any of our parents. So we have an aggressive campaign to try to raise some funds to expand our school to be able to serve our current elementary kids in 2 years, but also to be able to take in more Milwaukee children and ensure that they get a good education.
And for those who don't know, you're actually in a building where you can expand.
Yes, we're in an old hospital, Dr. Gleason. Old Aurora Sinai, I think it was, the old Milwaukee County Hospital. So we have 8 vacant floors above our high school. We only want one of them. We don't want to keep going up, but we're going to try to get some partners in to take some of those upper floors. But we're expanding into our 3rd floor of the high school side.
Awesome.
All right. Thanks again, everyone. See you next Tuesday.
Excellent program. Thank you.
Thank
Love it.
you.